Now, care of the patient with AIDS. Now, the reason I'm differentiating here between HIV and AIDS is if the patient has a low viral load and their CD4 plus T cell count is greater than 500, you truly treat them no differently than you would any other patient using standard precautions. And there's no special treatments that you need. The only special treatment that a patient with HIV disease needs is when their viral loads are higher, when their CD4 T cell counts are low, and they do not have the ability to fight off infections because the patient themselves is more immunocompromised. So that's what we're going to be talking about now, is care of the patient with AIDS. So this is a patient whose CD4 plus T cell counts are low, are less than 200 millimeters cubed, and their viral loads are high. So this is the stage 3 of the HIV classifications. So that means that they have that low CD4 T cell count, and they have a high viral load, or their CD4 plus T cell count is still between 200 and 499, but they already have a AIDS defining infection that we talked about on that table, 19.1, I believe, where it talks about the opportunistic infections of the patient with AIDS. That is, let me look quick. Yes, that's again the AIDS defining conditions of adults on page 340. So those are the people who have that, get them into that stage 3 of HIV classifications, which is considered the autoimmune deficiency syndrome. So the patient with AIDS is susceptible to opportunistic infections because of their reduced immunity. Again, because they have low CD4 plus T cell counts. The patient with AIDS often develops pathogenic infections and opportunistic infections. Pathogenic infections are caused by virulent infections that can occur from the patient's normal flora. Approximate precautions for the disease must be taken. And so when we talk about pathogenic infections, now pathogenic infections can be caused by organisms and can even happen in patients with normal immunity. Think about like the flu, and things such as this. Now, opportunistic infections occur because of the profound reduced immunity of the patient with HIV disease. They may result from primary infections or reactivations of latent infections. Opportunistic infections account for many of the signs and symptoms observed in the HIV/AIDS patient, including the protozoal fungal infections, many bacterial infections, and viral infections. More than one infection may be present at one time. The presence of an opportunistic infection may represent disease progression or temporary further reduction in immunity. These infections can result in death if not appropriately treated. Priority nursing actions when caring for a patient who is HIV positive is continually assessing and documenting for opportunistic infections, and also educating the patient on knowing what these opportunistic infections are so that they can keep an eye out for them as well. Opportunistic infections again occur because of the patient's reduction of immunity. So keep in mind that when there's an opportunistic infection, which is like the ones listed in table 19-1, they are not a threat to healthcare workers with an intact immune system. Unlike the pathogenic infections, you still would need to use appropriate precautions because you would still be susceptible to these types of disease, whether it's tuberculosis or things like that. But the opportunistic infections are not a threat to healthcare workers with an intact immune system. More about opportunistic infections. Protozoal and fungal infections are very common. Bacterial infections can be from other or as an outgrowth of normal flora. There also are viral infections. Malignancies, such as Kaposi sarcoma, are more common, or is the most common AIDS-related malignancy. And as you can see, we have pictures of that here on the slides and in the book. They are the outlying nodules on their skin, and they can be inside the mouth as well. It used to be a very telltale sign of patients who whose HIV status had progressed, especially in the early 90s. If you're interested at all, watch parts of the movie Philadelphia with Tom Hanks. When his character starts getting the sarcomas is when he loses his job, because he was able to hide his status as being HIV positive until that time. Now, again, this movie I think is in, I'm not gonna get it right, sometime in the very early 90s, late 80s. But that is an interesting movie that shows how society did not understand HIV at that time, and how people were scared that they would contract HIV even from just casual contact. That just reminded me of that. On holiday break, if you're wanting to watch some old movie, Philadelphia with Tom Hanks is interesting, and shows you about how the society has changed so much in the past 30 years. Some endocrine complications associated with HIV include some adrenal dysfunctions, can result from glands being infected by opportunistic infections, resulting in adrenal insufficiency. Other symptoms that are affected are HIV-associated neurocognitive disorder, or HAND, and HIV dementia complex, or ADC. These are all called HIV-associated dementia complex, and they refer to symptoms of the central nervous system. And it's usually where they have increased confusion, and they will have both cognitive and motor and behavioral changes. Symptoms can range from barely being noticed to severe dementia. Some neurological problems may be a result of the HIV infection. Others could be drug side effects, including some peripheral neuropathies. AIDS wasting syndrome is not caused by a single factor, but a lot of patients with with AIDS has diarrhea because of malabsorption and anorexia, and they can have both esophageal and oral lesions that can contribute to a persistent weight loss, and the patient may appear quite emaciated. Skin changes, including the sarcomas we were talking about, but also due to their dehydration status, they'll have dry, itchy, irritated skin, and a lot of different rashes, including some eczemas. And when the platelet count is very low, they'll have some petechiae. They'll have bleeding of their gums as well. You'll also see some kidney problems associated with HIV. Nephropathy are common. These can be from some different glomerular changes that can lead to both acute and chronic kidney disease. Of course, there's a lot of psychological assessments with these patients. They may have a very good support system, or they may not, and so it's important for those of us in the healthcare profession to make sure that they are getting placed with resources with the AIDS councils and community resources to care for them as their disease progresses. Speaking of caring, caring for the patient with AIDS, again, this is HIV stage 3. The patient with AIDS is susceptible to opportunistic infections because of their reduced immunity. So one of the things we as the caregivers want to do is, when we're caring for these patients, is to care for the patient with different nursing interventions to make sure that they are receiving the best care that we can provide. One of the first things we want to do is in our nursing interventions is to enhance gas exchange. A lot of times these patients will have respiratory issues, and we need to make sure that we are monitoring them. A lot of times, in order to take care of their gas exchange issues, you want to make sure that they are comfortable, because comfort can improve gas exchange. Make sure that they're getting rest between activities and that they're pacing their activities. You want to make sure that you are maintaining good skin integrity, because a lot of these patients have a lot of diarrhea, so you want to prevent diarrhea when absolutely possible. And you want to make sure that we're doing good hygiene and keeping that skin from breaking down and keeping that diarrhea off of the skin. Pain management, again, because of their emaciated state, a lot of times these patients need pressure-reducing mattresses. Their pain is sometimes cared for both with NSAIDs and opioids. There's some integrative therapies that are very helpful with your HIV population, including acupuncture and biofeedback. When you're looking at the dietary needs of the patient with HIV and AIDS, especially if they're in that stage 3, which is more the AIDS, you want to make sure that they're on a high-calorie, high-protein diet, that their fluid intake is between 2 and 3 liters per day. They're getting frequent mouth care, because this can also help to improve their appetite. And you want to enhance cognition. You want to make sure that they have a calendar in the room that is of the correct date and time. You want to make sure that they have a window so they can see when it's daylight, when it's dark. You want to make sure that no one says, "Hey, do you know who I am?" Because that sometimes can just irritate a patient who is mildly confused. So you want to go in and say, "Hi, my name is Jean Marie. We, work together." You want to make sure that so people who, when they come to visit, "Hi, Joe, this is your mom. I'm here to see you today." Not make them assume that they know who you are. I think that's very important anytime you're dealing with a patient who has mild confusion or some cognitive changes, that we don't go, "Do you know who I am?" Because all that really does is really irritate them. So I just always encourage family members to just tell them who they are. Like, "Hey, I'm Jean Marie. We work together. I came by to see how you were doing," so that they don't have to wonder who you are. Or, if you're their loved one, just remind them who you are. Because sometimes when you see them in a hospital, you're not in the context that you normally are, and it can cause some more confusion to the patient who already is having cognitive issues. Home care for these patients is to ensure that they have a good support system at home, and make sure that people who are caring for them at home know the infection controls for home care of the patient with AIDS. And these are listed quite nicely for us in chart, I would say over here somewhere, on chart 19-8 on page 357. It talks about, because a lot of times, especially in the early time of this pandemic, or with HIV and AIDS, people didn't want to take care of loved ones at home because they were scared that they would get AIDS from their loved ones. And so it was really important for people to know how to care for their loved ones at home, and make sure they had what was proper, make sure they had their gloves, and make sure that they knew what to disinfect with, and make sure that they knew what was important to care for. Make sure that they didn't reuse plates, and to make sure that they're removing any solid waste from contaminated trashes. Just look at that chart 19-8. It gives you some great ideas. It talks about making sure you're not sharing razors and toothbrushes. It just sounds gross in a general sense. You want to make sure that you're cleaning the bathroom services regularly with household cleaner. When I was working with hospice, one of the things that we did do with these people is we would encourage them to clean the bathroom after each use, at least with like a little, that 10% bleach, that 1 to 10 bleach solution, just to kind of keep the area clean, because it did two things. It didn't allow the patient who had AIDS to get an opportunistic infection from normal flora overgrowths, and also would clean the area as well. So these are some of the ways that we would help these patients and families care for each other at home. And that's about it, guys. Thank you very much.